Steve Adubato here. It is my pleasure to introduce Dr. Bob Atkins, who is Director of New Jersey Health Initiatives, Robert Wood Johnson Foundation, also Associate Professor at Rutgers University in Camden. Good to see you, Bob.
Yeah, thanks for having me.
We worked together over in Jersey City.
Yeah.
Tell folks what that was, and then we'll bring it over to Camden. What was that?
That was fun. It was an opportunity for the foundation to launch and talk about its really ambitious plan to build a culture of health in New Jersey and the nation. And so it was really an opportunity just to kind of start talking about what that was and bring in some really important thought leaders around that, and it was just a great event.
And the culture of health is, which we'll talk about, as being led by the Robert Wood Johnson Foundation. And I always say, full disclosure, you're underwriting programming on our partners, for our partners at NJTV and for us as well, promoting and dealing with this culture of health. What is it and why is it so important?
I think the culture of health is a logical next step of where the foundation has been driving towards. So the Robert Wood Johnson Foundation has been very interested in understanding how where we work, play, live, and learn affects our health and our health chances and our health opportunities. And so, you know, these social determinants of health, they're a piece of that also, but this culture of health really brings in that idea of, you know, how do we create this opportunity, this equal opportunity for all individuals to make choices and take opportunities and change how they live so that they live healthier lives.
And we're doing this program literally right after President Obama comes to Camden to talk about some positive things going on between the police and the community. But, and when that's part of the culture of health, but more precisely, the health of the folks in Camden, particularly the younger people.
Right. I mean, so it's great you talk about the younger people in Camden because I kind of got my start in Camden.
I
know
Camden.
Talk
about your connection to Camden.
So I came to Camden. I grew up in Cherry Hill, which is only a couple miles from Camden geographically, but a big jump socioeconomically. And I came to Camden fresh out of nursing school. I became a school nurse there. I was about 26 years old, and it's this place where I ended up buying a house. I met my wife. I had my first child. I worked there. I started a youth development group there, and I felt a very close connection to this place, which is, in many ways, it's a place that's like Cherry Hill. I mean, you have parents there and people there that want to raise their families and have kids there, really want to have interesting and constructive adulthoods, but there's these barriers that kind of get in the way, and then Camden really brings you kind of face to face what these barriers are. You know, one of the big barriers in Camden is you have, and they're all interwoven, right? So you have barriers into the school system, and you have barriers in the housing, and you have barriers in terms of where people can buy fresh fruit and produce and things like that. And they all kind of interact with each other to make it really challenging. And so with one of the things that I saw as a school nurse and working with youth there is one of the barriers is that there's a lot of opportunities for kids to make mistakes. It's almost hard to play the perfect game in Camden because there's always something that occurs that's really not in their control that can really kind of sidetrack and derail them. And you saw that. You saw it in Camden. You saw these kids that were really challenged to kind of just pick a path that was going to lead them to this healthy, constructive adulthood that we really want for kids. And
so the Robert Wood Johnson Foundation decides to do what? Let's talk about this.
Yeah, so the foundation has really leaned into this idea of how do we think about health in ways that involve not just the absence of illness, but really the opportunity to get healthy. And this is such an exciting idea because it really kind of speaks to these fundamental democratic ideas about equity, equality of opportunity, social justice. I mean, so these are really exciting kind of ideas.
That's what this country was founded on.
That's why, yeah. So this is,
it's supposed to be what makes our country so great.
Right. I mean,
supposedly.
And if we're going to have a pursuit of happiness, right, in these kinds of things, we have to have.
I read about that somewhere.
We used to talk about that, but life, liberty, pursuit of happiness.
Yeah, right.
That all requires health. That all requires people to be able to kind of make healthy choices and live healthier lives. I mean, it's something that it's one thing to tell people, oh, eat well, get enough exercise, go see your provider. It's another thing to talk about how do we create the opportunity so you can do those things.
So the foundation has picked 10 communities.
Yes, so the foundation
to target your resources to do what? Describe this.
Right, through the New Jersey Health Initiatives, which is...
The New Jersey Health Initiatives, go ahead.
Yeah, New Jersey Health Initiatives is a program of the foundation, a statewide grant-making program of the foundation. And in some ways, it's a very great reflection of the foundation's commitment to the state of New Jersey, right? So it's been 30 years the foundation has, through the New Jersey Health Initiatives, funded programs, community-based organizations, institutions, individuals in the state to improve health and well-being in the state. And so New Jersey Health Initiatives, which I have the pleasure of directing, really kind of follows where the foundation's priorities are. And where those foundation's priorities are, New Jersey Health Initiatives gives funding to community-based organizations. And obviously the foundation's priority right now, as you just talked about, is building a culture of health. And so building a culture of health is starting right here in New Jersey. We're going to fund 10 communities throughout the state who are going to really work across sectors. I mean, so it's bringing faith-based groups, elected officials, schools, higher education, social service and health service agencies, hospitals, foundations, all coming together in their community and really working, sitting down and thinking, what do we need to do to make our city healthier? So our city being Atlantic City, or Salem, or Camden.
Or Orange, New Jersey.
Or Orange, which is a really exciting proposal because that's where the lead agency in that community is a school.
That's right, the Orange Public Schools.
Orange Public Schools.
Or Irvington, the township of Orange, or Salem,
in
as
the
you
shadows of
said.
Newark, or Salem County, out in the middle of nowhere.
Which is the United Way of Salem County, or Elizabeth, New Jersey, right outside of Newark. Morristown, New Jersey.
Right.
Jersey City. So many 10 locations.
Right, and Morristown picked one census tract within Morristown, one census tract which is distressed, which needs a lot of help, which only has 6,000 people in it, but they are going to focus on how do we move the needle in this one community. And so that's really exciting, basically one neighborhood.
How long does this go on for, and when are you going to look at it in terms of say, hey, how successful have we been with this?
Yeah, so the first step of this program is what we're going to do is these communities are going to get together. They've identified their teams, they've identified their different sectors that they're going to engage in this, and they're going to develop a blueprint. They're going to receive some of our resources and leadership training, and they're going to develop a blueprint to think about what do we want to do in this community. There's so many things we can do, but what would be most important first step in here? And that's in year 1. And then in years 2, 3, and 4, we're going to be providing funding to help them take this plan they've had and implement that plan. And for us, it's really going to be important because it's going to allow us to build capacity. And because we're grant makers, we always think about how do we fund those individuals who can make the biggest difference in their communities.
And to be clear, those of us in public broadcasting will be tracking, following, reporting on and analyzing those results and making sense of them for the public. Yeah. Last question for you. I'm curious about this. Two quickies here. First of all, what would you say your greatest leadership lesson you've learned so far in all this is? You've dealt with all kinds of situations. Number one leadership lesson is?
Great. The number one leadership lesson is relationships matter. Relationships. It's all about the relationships. So as a school nurse, it was relationships I made with these kids and their families and the other individuals that really were trying to support them. As somebody that started a community-based organization in Camden, when I started this Camden STAR program, which was, STAR program stands for Sports Teaching Adolescents Responsibility and Resilience. And so we worked starting in 1995 to 2010. We worked with kids in Camden, hundreds and hundreds of kids, and tried to provide them opportunities to play soccer, which we thought was important, but also do civic engagement through community service, and also do things like academic enrichment. And when I started the program, I was a young school nurse in Camden. When I started, I thought it was all going to be about the money. I said, we're going to need money, and I'm going to be happy, but the money was easy. The money, getting people to write checks.
What was the hard part?
Hard part was getting people to come and be able to, engage in this, work with adolescents. Work with adolescents, that's hard. I mean, because adolescents, they're in an age when, we kind of start to kind of push them away. They don't smell as good. Their language gets to be a little bit salty, and we're less willing to engage with them. But, as we were able to bring in people that were caring, consistent adults that show up every day and make a difference in their lives, those relationships made the difference. Never the money. The money was always easy to get.
Good stuff, man.
Yeah.
By the way, you also told our producer, we'll talk about this another time, this may be the first generation of younger people not as healthy as the previous one. Right?
Yeah, isn't that astounding? Yeah.
That's scary.
Yeah, it is scary.
And we'll talk about that next time.
Yeah.
That's powerful stuff.
Yeah.
Thank you so much. We appreciate that.
Thank you.
Good stuff. Robert Wood Johnson Foundation. We'll be right back right after this.
Thanks.
That's important.
Yeah, thanks.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the New Jersey Education Association, Bloomfield College, Qualcare Inc., New Jersey Sharing Network, the Russell Berry Foundation, Choose New Jersey, and by Verizon Communications. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.